Now we will talk about very important topic in AMC exam, which is blood pressure, hypercholesterolemia, and diabetes mellitus screening and prevention. Let's start by blood pressure. For blood pressure screening, the screening should be done to all population and should be started at 18 years and repeated every 2 years. So please focus on this number. In case of diabetes mellitus, screening should be done to all population starting at 40 years and repeated every 3 years, and by using fasting blood sugar or hemoglobin A1C as a tool for screening. Okay? And finally, for hypercholesterolemia, you should make screening to all population started at 45 years and repeated every 5 years by using fasting lipid profile. So I think it's clear and simple. Now let's talk about the exceptions in case of diabetes mellitus, which is very important. As I said, for general population, you should start at 40 years and repeat it every 3 years by using fasting blood sugar or hemoglobin A1C. What the exceptions include: first, Aboriginal population. In case of Aboriginal population, the screening for diabetes mellitus should start at 18 years and repeat it every 3 years by using, as I said, fasting blood sugar or hemoglobin A1C. So in case of Aboriginal, if the case scenario talking about Aboriginal patient, then make the screening at 18 years, not 40 years, and repeat it every 3 years. The second exception include impaired glucose tolerance. In case of impaired glucose tolerance, repeat the test every 1 year, not every 3 years as above. What I mean by impaired glucose tolerance? Well, for fasting blood sugar, the normal level should be less than 5.6. If it's less than 5.6, this is a normal patient. If it's more than 7, then this is a diabetic patient. If between these two numbers, this is called impaired glucose tolerance. And for random blood sugar or oral glucose tolerance test, the number here is 7.8. If less than that number, this is a normal patient. If more than 11, then this is a diabetic patient. If between these two numbers, I mean between 7.8 to 11, this is called impaired glucose tolerance. For this patient, repeat the test every 1 year, not every 3 years. And finally, pregnancy. In case of a pregnancy, the screening should be done by using oral glucose tolerance test, not using fasting blood sugar or hemoglobin A1C. Focus on this. This is the only use of oral glucose tolerance test. So in case of pregnancy screening, you should use oral glucose tolerance test at 24 to 28 weeks of gestation. And there are many different exceptions for this. Please refer to gestational diabetes mellitus for full information because it's very important. So in general, in case of a pregnancy, the screening should be done by using oral glucose tolerance test, and you should make the test between 24 to 28 weeks of gestation. And please, there are a lot of exceptions. Please refer to gestational diabetes mellitus. And let's talk finally about screening for diabetes mellitus complications. And these include checking the food should be done every 6 months, and checking for hemoglobin A1C should be done every 6 months, and checking the eye of the patient should be done every 2 years. Okay? And finally, a very important note is that a patient came to you with a positive family history of diabetes mellitus, maybe first degree, maybe second degree, maybe others, I don't care. For this patient, you should treat him as any other patient, I mean the general population. So the screening should be done at 40 years and should be repeated every 3 years by using fasting blood sugar, okay, or hemoglobin A1C. So he is treated as any other normal patient. That's all what you need to know about this topic for AMC MCQ exam. For full course, you can contact us through amcqbook@gmail.com. Thanks and goodbye.